Hi, this is Eric Locke. Sorry I can't be there in person today. So I'll speak a bit more on the New England Journal of Medicine meta-analysis, which was published in 2007 and was really the first study to seriously suggest a connection between cardiovascular risks and Avandia. So this study was a meta-analysis which combined the results from 42 different clinical trials, all of which involved a group of patients taking Avandia and another group with some kind of control, which varied from study to study. So this table gives the total number of participants and number of participants that had either a myocardial infarction or a death from cardiovascular causes across the various trials. Notice that all these studies combined involve a lot of participants, in the 10 to 20,000 number of participants, but there are few cardiac events, less than 100 total in either group. And the lack of events is partly due to low follow-up time in a number of these trials. I think the minimum follow-up time was 24 weeks. This was a fixed effects meta-analysis, which means that any potential heterogeneity between the different trials was ignored, and they simply added up the total number of participants across the trials who had a myocardial infarction and compared that to the total number of participants across the trials for both groups. And when they do that, they found that slightly more in the Avandia group had a myocardial infarction. The odds ratio was 1.43, which means a 43% increase in the rate of myocardial infarction among the Avandia group. But due to the relatively small number of events, there's a lot of uncertainty around that estimate. So a 95% confidence interval gives anywhere between a 3% and a 98% increase in the risk. And when they look at death from cardiovascular causes, they saw a similar increase in the risk, a 64% increase. Some criticisms of their analysis: the results were combined for very different trial designs, which suggests heterogeneity that may not be well accounted for in the fixed effects approach. They did not account for differences in follow-up time across the different trials, which is important because we expect the rate experiencing death or other cardiac events to be affected by the length of follow-up time. And the criteria to include or exclude different trials from the study was somewhat arbitrary. In particular, they excluded any trials that did not have any myocardial infarctions or cardiac deaths. And there's really no statistically valid reason to do that, especially if the sample sizes differ among the groups. Those studies that had no events can still be informative. Despite these drawbacks, I thought the article itself was relatively fair and measured in its tone. Here's a quote from the study. Because exposure of diabetes patients to Avandia is widespread, the public health impact of an increase in cardiovascular risk could be substantial if the data are borne out by further analyses and the results of larger controlled trials. Nevertheless, in the press, the conclusions were not as nuanced. Here's the New York Times article that states heart attack risk seen in drug for diabetes, with one of the study authors quoted as saying, "It's a huge risk. Tens of thousands of people had heart attacks as a result of taking the drug," which is certainly possible, but hard to conclude definitively from the data. Here's another headline from the ACP Journal Club saying Avandia increases risk for myocardial infarction, but does not differ from other drugs for cardiovascular death and type 2 diabetes. This is from a review of the NEJM meta-analysis, and they summarize the main result as Avandia increased risk for myocardial infarction more than placebo or other drugs, but groups did not differ for cardiovascular death. And claims like this, I think, if anything, just illustrate the arbitrary nature of using a p-value cutoff like 0.05 to make firm conclusions. The increased risk of myocardial infarction had a p-value just under 0.05. The increased risk of CV death had a p-value just over 0.05. But really, the weight of evidence for both outcomes is about the same. Both are suggestive of an effect, but certainly not definitive. In fact, the increase in the odds of CV death for the Avandia group was actually higher. So after this study came out, the use of Avandia decreased substantially. In 2010, it was banned in United Kingdom, India, New Zealand, and South Africa, largely due to the potential for cardiovascular risk suggested by these meta-analyses. And in November 11th, 2011, the FDA restricted access to the drug substantially. Some steps taken were to require a mail order through particular pharmacies, and patients had to be fully informed of the cardiovascular risks. Thanks.